Let us now learn about handling waste. During a disease outbreak, an epidemic or a pandemic, waste from households and organizations can transmit infectious germs and viruses and thus pose risk to the health of people. That is why it is imperative to follow health and safety guidelines for waste management at home as well as workplace. Procedure for safe disposal of non-healthcare waste. Waste should be collected in a plastic rubbish bag and tied properly. The plastic bag should then be placed in a second bin bag and tied properly. Waste should be stored safely in a suitable and secure place until the individual's test results are known. This is applicable in case any individual at home or workplace is suspected to have caught the infection. Waste should be kept away from children. Waste should not be thrown in communal waste areas until negative test results are known, or the waste has been stored for at least 72 hours. If storage for at least 72 hours is not appropriate, arrange for collection by the local waste collection authority. Waste management entails the processes which includes the following steps. Analyze the waste. Segregate and collect the waste. Transport the waste for treatment. Recycle or reuse the waste. Dispose of the waste responsibly. WHO recommends that after each time utility gloves or heavy-duty, reusable plastic aprons are used, they should be cleaned with soap and water, and then decontaminated with 0.5% sodium hypochlorite solution. Single-use gloves made of nitrile or latex, and gowns should be discarded after each use and not reused as they could have come in touch with infectious waste. Hand hygiene should be performed after pay is removed. If greywater includes disinfectant used in prior cleaning, it does not need to be chlorinated or treated again. The procedure for safe disposal of healthcare waste is as follows. Yellow bins. Post-operative body parts, placenta. Plaster of Paris. Pathological waste. Cotton waste and dressing materials. Beddings. Body fluid, contaminated paper and cloth. Face mask, cap. Cytotoxic, expired and discarded medicines. Microbiology, biotechnology lab waste needles. Red bins. Syringe without needles. IV set or bottles. Catheter. Gloves. Urine bag. Dialysis kit. Blue bins. Glass such as ampoules and lap slides. Metal such as nails, metallic body implants, and scissors. White or translucent. Needles. Syringes with fixed needles. Blades. Scalpels. Watch animation on how waste collection workers can minimize risks during a pandemic, for example during COVID-19. Dealing with stress and anxiety during a disease outbreak. A disease outbreak, epidemic, or pandemic brings about numerous challenges such as the illness, fear, and eventually stress and anxiety. We need to understand the impact of stress and anxiety on our physical and mental health. Stress lowers our immunity and makes us more vulnerable to viruses and illnesses. You need to change your mindset and take some practical measures for your safety and security. People diagnosed with a disease and their family or neighbors often feel sad, stressed, confused, scared, or angry. Such people should talk to people you know will provide help and listen. Share your feelings with close friends and family. People in self-quarantine or self-isolation should maintain a healthy lifestyle. Take proper diet. Ensure a healthy routine, proper sleep, exercise, and social contact with loved ones at home and by email and phone with other family and friends. Do not smoke or consume alcohol, other drugs to deal with your emotions. Ask for professional counseling if extremely stressed. People living in contamination zones, areas most affected, should gather information to analyze the risk and necessary precautions. Find a credible source you can trust, such as Arogya Setu app, WHO website, or a local health authority. Restrict watching too much news or media coverage of the epidemic to avoid worry and agitation. Focus on personal and interpersonal skills that have helped you to recover from a tragic experience in the past. In this unit, we learned that identifying and reporting the symptoms of a disease can help in seeking timely care. Reporting a positive test result for a disease helps in taking immediate actions to prevent further spread of the disease. Waste management has a significant role to play in controlling the spread of infection. Effective waste management entails following prescribed procedures for proper collection, segregation, transportation, and disposal of waste.